Have you ever wondered what happens when you become unconscious or unresponsive from a car accident, or when you were swimming and became unconscious? The letters CPR stand for cardiopulmonary resuscitation, and CPR is one of the main ways to get someone who is unconscious revived back so they are able to breathe on their own. The American Heart Association approximated that around 100,000 to 200,000 adults and children each year could be saved if CPR was performed early enough. I am a Red Cross certified lifeguard, and in this demonstration I will be showing you how to do CPR with one person for an adult, child, or infant, and CPR with two people for an adult, child, or infant, and to know when you should stop performing CPR on a person. I will be showing you how to do CPR with just one person for an adult, child, or infant. The first thing you should do when you suspect a victim is unconscious is you need to check for a pulse. For an adult and child, place two hands firmly one on top of the other using the heel of your hand. Do 30 chest compressions, and when you're done with the 30 chest compressions, put the adult and child CPR mask on the patient's mouth and over their nose, and then do 2 rescue breaths. This should be done for 2 minutes or 5 cycles. Then, after that, if they are not breathing, you should continue doing this. And if they have a pulse and are breathing, you should stop. For an infant, place 2 fingers in the middle of their chest and compress in about 2 inches. And then for an infant, do 15 chest compressions, and then place the infant CPR mask over their mouth and nose and do 2 rescue breaths. This should be done until paramedics arrive or they start breathing again. Next, I will be showing you how to do CPR with 2 people for an adult, child, or infant. For an adult, after you have made the discovery that the patient is unconscious, rescuer 1 makes sure the mask is on the victim in the correct spot. Rescuer 2 makes sure their hands are in the correct position. Then rescuer 2 starts doing 30 chest compressions. After the 30 chest compressions are done, rescuer 1 should do 2 rescue breaths. Again, this should go on for 2 minutes or 5 cycles, and then rescuer 2 says switch, and they both switch jobs. For a child or infant who is unconscious and not breathing, rescuer 2 does 15 chest compressions, and rescuer 1 gives the victim 2 rescue breaths. Again, this should go on for 2 minutes or 5 cycles. Then rescuer 2 should say switch, and they both switch and keep going. The only other time you should stop doing CPR on a victim is when paramedics arrive. But when they arrive, you should not stop doing CPR. You need to transition them into doing the CPR so they can take the victim to the hospital for further treatment. You might ask yourself, what signs will I see from the victim to know when I should stop doing CPR or when I should keep going? The only time you should ever stop doing CPR on a person is if they have been revived. And what I mean by that is when they start breathing after you have done CPR on them, you should stop. If the person who is doing the CPR is just too exhausted to keep going, then you should stop. In this speech, we have learned how to perform CPR on an adult child or infant who is unconscious, not breathing, and has no pulse. How to do CPR with just one person for an adult child or infant, and how to do CPR with two people for an adult child or infant, and when to know when you should stop performing CPR on a victim. Now that you know how to perform CPR on an adult child or infant, maybe the next time you see a person who is not breathing and has no pulse, you can revive them back so they are breathing again and save their life.